So, Dr. Patel, what changes have been implemented at CBCCA to address the COVID 19 pandemic?
We thank you. That's a very good question, Dwani. And we are trying to both address the current situation as well as future potential of many employees getting exposed to the virus, irrespective of whether they get it from the community or somewhere else. So, anticipating what could be worse, we've reduced the number of hours at the satellite office, and we've kept one satellite office open only for 1 day a week, mobilizing all the other employees to the main center so that we can concentrate services in one location. Then we categorize patients based on the intensity. So going back to the patients who need urgent treatment, which includes acute leukemias, aggressive lymphomas, aggressive cancers, we try to prioritize them and see them as and when they had to be seen, and we put them on treatment on a priority list. The second priority we created is what we call intermediate priority. These patients essentially are chronic long-term maintenance treatment who are in stable disease or who've got partial remission. We are trying to space out their visit. We are trying to see if we can use the new targeted therapies and precision medicine driven approach to switch them from the highly myelotoxic chemotherapy to orally administered new class of drug, which is TKIs, the protein kinase inhibitors, patients on the newer class of drugs, anti-fusion protein inhibitors, etc. And the third category would be the routine follow-up patients for hematological concerns, low blood count, AMGUS, low-grade lymphomas, low-grade chronic lymphocytic leukemias, low-grade MDS, and intermediate MDS. If this patient's treatment or follow-up can be stretched out to about 3 months or 4 months, we are trying to do that. And also we implemented very aggressive telehealth, that maybe Taylor can share what we are doing on the telehealth side.
So we are reaching out to each of our patients. We've had the physicians kind of go through each of their patients and identify which ones would be most appropriate for telehealth. And then we've kind of used our entire staff to employ telehealth as a whole. So calling patients at different intervals that the physicians have identified, calling patients to check if they need refills, if they need anything, are they having any symptoms, anything that we can address over the phone before bringing them into the clinic, potentially exposing them or exposing us as a workforce.
Great, great. So my next question is, how Governor McMaster has declared a state of emergency for us in South Carolina and shut down some of the Lancaster County operations, which is where one of our offices is. How has this impacted our overall operations to treat patients?
That's very, again, distressful situation, and I don't blame administration, because administration has to do what is in absolute necessity for the society as a whole. So we are able to accommodate most of the patients from satellite location, and for those patients who have difficulty traveling, we are going to keep that office open 1 day a week so that we can concentrate all the patients' essential chemotherapy on that day. On the same note, I really want to bring up our employees as well. So our employees have to travel from one location to the other, and here is I really want to bring in the novel idea of our personal protective equipment that we are providing to our employees, and you can actually elaborate on that, Taylor.
Sure. So we actually have had people who have volunteered to make masks for our employees. We have about 20 of these fabric masks. We have about probably 20 to 30 more that are going to be made with filters in place. So we've distributed these around our office to where the fabric ones. The idea with these is that we can then sanitize them and continue to reuse them should we encounter some shortages. We're using the face shields for nurses with direct contact with patients. Anybody who feels that they need one, we have them available for them as well. So.
Perfect. And we also are following CDC guidelines about checking with patients before they come to see if they have a temperature. If they have a temperature, we encourage them to stay home. If they have medical necessity to be seen, we take all the personal protective measures very seriously, apart from training our employees for the hygiene as well. And we're trying to ensure that first of all, our patient's care is not compromised. Second is our employee health is appropriately maintained both for a professional reason as well as personal reason. Do no harm is our first principle, and our employees' health is number one priority for us as well. So we are trying to create a balance between treating the patients and maintaining the employee health.
And that leads me to my next question, Dr. Patel. Can you talk about promoting disease prevention to our patients and staff during this tough time?
Absolutely. So we've been educating our patients about the how does the coronavirus spreads, and of course, droplets or the fomites are complicated words for patients to understand, but simply if someone sneezed over on my face, there's more than likely that if that patient carries virus, it will be on my face within distance of 2 to 3 feet. So social distancing is of course very important. Actually will reduce the person to person spread, although it's less common way of spread. The more common way of spread is the fomites when somebody sneezes in the room, if they carry it on the clothes, if they touch the different surfaces. So we are maintaining very rigorous and very vigilant cleaning practices, and maybe Kelly can explain about how we maintain our hygiene.
Yeah. So we're using the sanding cloths and basically on all horizontal surfaces that could be touched, could be potential spread environments. So every few hours we're wiping those down in our waiting room, in our nursing station, everywhere. And then also just using this Lysol disinfectant spray in the rooms after patients have been in them. Every time a patient leaves, our medical assistants spray the room down.
And of course, I personally demonstrate my own unique way of protecting myself, which is steam inhalation, and many of the beautiful women will be quite familiar with the fact that they go to different beauty salon and spa, and they get the steam over their face to clean any of the bacterial infection that they have. And I feel that one of the surest way of reducing the risk of rapid progression of the viruses within the nostrils, which is the common route of entry, is to expose the viruses to 63 degrees plus centigrade temperature. I cannot burn my nose, but I can actually look into doing steam inhalation on the boiling water, ensuring that creating balance between not hurting myself at the same time, allowing enough exposure of the steam that directly comes out of the utensil, and then expose my own face and nose, which is the commonest way that the virus enters into my body. And this is not something that's been tried in prospective randomized trials, but this is not the time that we can wait. I think I have to take personal step to ensure that I do not become a source of infection to anybody else.
Great. So what advice then can you give to other community practices at this time?
It's very important for all of my colleagues across the country, first of all, to ensure that we do not become the hotbed of spread. So we have to take all the measures in line with CDC recommendations, which is safe distancing, which is cleaning, which is, in a time of distress and war like this one where we don't have supply of protective masks, we figured out a way of, reaching out to our patients who help us with creating the non-disposable reusable mask, and we wash them aggressively in the hot boiling water for about 15 minutes or 30 minutes even at a time, providing personal protective equipments. This is some of the things that we can do to reduce the spread, but anticipating that there will be staff shortage, anticipating that there will be employee issue, anticipating that there will be priority needed to be done, prioritize your patients by disease category, disease severity, need for treatment, and prepare accordingly. And I'm coming out with an article in Targeted Oncology sometime early part of next week, where I've highlighted how we put different priorities of the patients in categories and how we are going to treat them without overloading and overburdening the services.
Wonderful. Dr. Patel, what advice do you have for the regulatory and governmental bodies as they continue to manage this crisis?
Well, I'm a little kind of hogging the whole game, but for the big powers to be in DC who really want to find rapid solution, we may not have time to do phase 2, phase 3 studies that are randomized prospective control studies. And 21st Century Cures Act has created a path for the FDA to look into possibility of disease and drug registries. In a time like this one, we could learn from our colleagues overseas what they've done. Has there been any success stories? We can look into records of patients who got better after certain intervention. I'm not going to mention a drug because that will create a crisis, but all I say is we could go out to other communities across the world, get the data, get the registry, analyze the data, and see if we can have a rapidly expedited approval process for a specific drug that would help patients alleviate the crisis.
Great. Thank you, Dr. Patel. Thank you, Lavender, Taylor,
Thank you.
for your time.
Thank you, Dwala.